Hello everyone, I'm Dr. Lim. Today's topic is postural drainage. When I'm studying this topic, it always made me crazy and confused to memorize whole pictures before I'm taking real NPTE. That's what I'm here, how to break this topic. Okay, if you're confused and feel depressed when you answering postural drainage topic questions, you must know how to draw and how to memorize this postural drainage. That is the key factor that you know to solve these problems. When I was studying, I found that there was always different pictures from every different books. I suggest you to memorize this picture, this whole picture. Must follow if you are still confusing. All right. There is long. Yeah. And this is the apical part. And this is the upper part, right? And this is the middle part. And the other things are the lower part. Like this way. And the half side of the here anterior part, and the other side is posterior part. The apical part is reclining position for postural drainage, and this is S supine position, and one S still supine and supine. This is the sideline and the prone position. It also and prone position and also prone position. All right, that's it. If you draw with these pictures, then you're gonna answer the question quite really easy way. And if you need add more information, just add it. Just add. But baseline must be from here, must be from this long picture. All right, you must draw it. Then the questions will be really easy. All right, what I can yeah. One more time. I want you to explain it. All right. This part is the apical part of the lung, and this part is the upper lobe of the lung, and also this part is medial lobe or lingular, middle and lingular part, and this is the superior of the lower lobe. Okay, and this is the anterior of the lower lobe, and this is the lateral segment of the lower lobe, and this is the posterior segmental of the lower lobe. All right, so if you know this picture, then the questions will be real easy. That's all. Question number 1. I want you to answer this question. I will give you 50 seconds. All right, one more. The question number 2, I also give you 50 seconds more. Okay, then rationers, right? I told you when I'm faced with postural drainage questions, I always draw it. I always draw it this again. When I'm faced with this, I always draw it this again. Yeah. And apical are right, and upper part, spine and prone, and the middle part also spine, and the lower part prone, right? Lower part of anterior also spine, and lateral is sideline, right? And it also prone, right? Then what is this? Patients place in a sideline position, right? Sideline position. What sideline position in this long drainage, postural drainage? The only sideline position would be here. This is for the lower lobe of lateral segment. Lower and lateral segment. Where is it? Yes, this is right. So B, option B could be the answer, right? Okay. And then next question. Question number 2. I also draw it again, all right? I also draw it again if I'm real confusing. Yeah. Draw it again. Apical arch and the upper part, spine, prone, and middle part and lingular, spine, and lower superior prone. Lower anterior spine, lower lateral sideline, lower posterior prone, right? But in these questions, what is this? Posterior basal of lower lobe, posterior drainage. What is this? This is for here, right? So it could be prone position. Prone. And prone is here. And if you really don't know the position of the head or the feet, you must precisely read, read the sentences again. And this is quite a complicated questions. If the question is more difficult, their options could be added more like this way. The patients with cranial surgery a week ago, right? If there is cranial surgery, what do you think about the head position? Yeah. If the head could be down, like Trendelenburg position, there is blood pressure could be elevated, right? That could be dangerous for head surgery patient, right? So the answer must be A. That's what I want you to know. What I want you to know, the whole topics from here, you should know drawing. The baseline is the draw, and then you added more information from here, from this draw. All right. Okay. So the answer could be A. Thank you for watching this video. Thank you.